Back to you. Nice. All the freedoms we have in this country, I don't think we have
different colors.
You are used to all those words and for sunset. We have thank you. Benjamin, thank you. $100 Benjamin Franklin. Benjamin, sir. Your name is on the also invented electricity.
American actor. American actor.
Running down from campus.
It is all yeah. So the starting I'll just introduce.
Excuse me, sir.
Yes,
There's a senior manager quality nursing. There is a manager and assistant manager. Can I introduce them also, sir?
Yeah, after I announce the topic. Yeah.
Sure.
Shall we start the grand rounds? I request everyone who's standing in the back, please carry your plates and you can sit down and eat for the whole hour there's no rush. Well, good afternoon. Welcome, everyone. I think today we have a friend of mine, a colleague, Houstonian, a Texan, an original Hyderabadi, Dr. Kota Reddy. Dr. Reddy is a graduate of Gandhi Medical College and subsequently migrated to the US. And he finished his residency at the Baylor College of Medicine, the very same place where I graduated from. And thereafter, he did research at Stanford. And then he came back to the Texas Heart to do his cardiology fellowship and subsequently his interventional cardiology. A very brilliant student, from the days of his medical school. And an interesting journey that he has. He was working in a very busy hospital as an interventional cardiologist. Now, obviously, we have interventional cardiologists here. I don't have to tell you what they do, but Dr. Reddy was very skilled, was very respected interventional cardiologist, which he practiced only for 8 years. After that, something dawned on him. He said, what I'm doing is probably not what I wanted to do, perhaps. I think I'll have him explain that. And we were also kind of a little shocked in Houston. How could a very successful cardiologist, all that stuff in front of him, suddenly change gears? And he went into preventive cardiology. And he embarked on that preventive cardiology, and he has done various things. If you Google his name, and you can find out about him. He started the Reddy Wellness Center and the Diabetic Reversal Center, and he has treated thousands of patients. And I don't want to go into details and let him explain. Then he published an interesting book, which most of his patients read, and a lot of friends that I know of read your book. And it was Eat Well and Eat,
Eat this, lose that.
eat,
This, lose that.
eat this and lose that. Eat this and lose that. And he has very interesting success stories in terms of management of cardiovascular disease and obesity and diabetes, where some of the friends and my own patients used to come out and tell me, he took me off all the medications. I lost so much of weight, now I don't have, my sugars are normal. Then I thought this guy is doing something crazy. I said, how is this possible? And then he started, he invented his own bread. It's called Kota bread?
Ready bread.
Reddy bread, okay. It's called a Reddy bread. It's supposed to be carbless bread. And that bread was very popular. A lot of people used to say that I eat the bread and then I lost so much of weight and whatnot. I think with this brief introduction, the way in which it happens to be here, I was in Houston. Was coming back, was at a wedding. His wife was there. I said, where is he? He said he's in Hyderabad visiting his parents. So this happened on Friday or Saturday. So I texted him and, hey, listen, you have to give grand rounds. You're in Hyderabad. Then he said, I'm not carrying a jacket. I don't have a suit. And his wife was sitting at the same table where we were at the reception. And she was telling me, Guru, that he's telling that he has no clothes. He just came in jeans and some shirt and some, can he just come like that? Yeah, he can come like that. He can come in shorts. There's no, there's no compulsion that you have to wear a jacket. Then his wife tells me, oh no, Dr. Reddy is always dressed in a jacket and a suit, and how can you do that? I just do that for the sake of Praveen. You know why I do it. I'll rather be like that. What he's wearing is the casual at the end of the day. I think with this introduction, we'll have Dr. Reddy in a minute speak. Before that, I think you have some announcements, Bobby. Welcome. Thanks.
Good afternoon, everyone. There are three new joinees whom I'd like to introduce to you all. The first one is Krishna Veni. She has joined as a senior manager quality. She has over 16 years of experience across hospitals in Pune, Aditya Birla, then Jaslok Hospital, Mumbai, and Care Hospital. She has experience both in NABH as well as JCI. So we welcome you, Krishna Veni. Thank you. And we have two new joinees in nursing. One is the Deputy Manager Nursing for Quality, Shiny. Previously, Manager used to take care and then Saujanya. So now the nursing quality vertical will be handled by Shiny. She is a master's in nursing candidate with 9 years of experience, have exposure in NABH, Nursing Excellence and JCA as well. And welcome you, Shiny. And yeah, we have an Assistant Manager Nursing. She has 10 years of experience. She's a bachelor's in nursing with a master's in hospital admin. And she has experience across corporate hospitals like Apollo Max. In Apollo, she was at the bedside, and in Max, she worked as a service excellence executive. So here we have taken her as assistant nurse manager, who will be taking care of the service excellence vertical in nursing. Also, she'll be assisting Sandy with the quality activities. So welcome you. Yes, sir.
Good afternoon. Good afternoon. Yeah, good afternoon. And thank you. Guru, thank you for the introduction. And how come these seats are empty? See, when I was in class, I always used to sit in the back because I didn't want. It's a bit heavy. Okay. So I used to sit in the back because I was scared of being asked questions. Gandhi. So now I want everybody to come forward, please.
Only if you promise not to ask.
I'm going to ask questions if you're sitting in the back. So I'm going to start asking questions if you sit in the back. If you're going to.
I think you might be lucky. I've been doing this for 10 years.
Then I want to ask the gentleman sitting in the back, what do you expect from this talk? Since you're sitting in the back and you don't want to sit in the front. Can you please stand up? Everyone in the back will be asked a question if you don't come in the front.
This is a lot more comfortable.
So, thank you all. And before I start, I have a little story. How many of you know about Drona and Ekalavya? Right? So Drona was, of course, he had his student, Arjuna, and he was always mentoring him and didn't want anybody to excel Arjuna. So Ekalavya wanted a mentor, and he didn't get one. So what did he do? He had a clay statue, and he practiced in front of the clay statue, and the clay statue was the mentor for Ekalavya. So in a similar fashion, Guru has been my mentor, meaning when I was in 10th grade, his name appeared in Deccan Chronicle. And my father was reading it and he said, look, come here, look at this. Dr. Gurunath Reddy, he bagged, I think, 13 gold medals out of 14. And his name was there. So he cut the paper cutting out and gave it to me. So I had that in front of my desk for 11th and 12th. And he was the driving force for me to work hard to succeed because I was an average student. I had no goals as such. But after seeing that, I pushed myself and I got into Gandhi Medical College the first attempt. And of course, since then, life changed. So he has always been my mentor, whether he knew it or not. And always, I walk with my hands in my pocket when I'm around him. You know why? Because I don't want him to ask me Guru Dakshina, my thumbs. So I thought he might actually ask me for my thumbs. So I quit interventional cardiology, went to non-invasive cardiology. But he's always been a mentor, whether he knew it or not. But every time I look at him, he's an inspiration. So having said that, thank you, Guru. So let me start my talk. About 27 years ago, I was flying out of Hyderabad, and those days we had to fly from Hyderabad to Bombay and Bombay to US. So I was in my second year of fellowship, and a Chinese guy was sitting next to me. So we started talking, and this guy was speaking good English. So I asked him, what do you do? He said, I buy pharmaceutical drugs from Hyderabad because Hyderabad is #1 for pharmacy, and I export it to take it back home to China. So then he asked me, what do you do? I said, I'm a cardiologist. I'm in training. He says, oh, my friend came from China to Madras. I said, why would your friend come from China to Madras? Oh, he wanted to do cardiothoracic surgery. And you know the words he used? He said, we know that you have heart disease and we don't have heart disease. So he came to Madras. He spent 3 years doing cardiothoracic surgery. And by the time he got back home, because he had done so many cases, they made him a registrar. He said it is extremely hard to become a registrar in Beijing. Now, at that time, Lancet had published a study showing, talking about Indians and heart disease and how Indians had premature heart disease. And so in Houston, I started giving little talks about Indians and heart disease even during my fellowship. And when I came here and I was talking to my friends, nobody had an idea that Indians were at high risk for heart disease. No physician in Houston or in America had any idea that Indians were at high risk for heart disease. How did the Chinese know that Indians were at high risk for heart disease? Meaning, were they already spying on us? It's interesting. And then later on, things changed. So keep that in mind. Why do Chinese don't have heart disease? And why do we have heart disease? So when I heard that, I said, maybe we are genetically at a disadvantage because Indians are at high risk for diabetes. Now we are seeing Indians with heart disease. So are we genetically exposed, at a disadvantage that we're going to have these problems? So that's where I started my journey, thinking that genetics and cholesterol. So we have high cholesterol, we have bad cholesterol, and no matter what we do, we are at risk for heart disease and we are going to die prematurely. So that's how I started my career talking about Indians and heart disease. So now I'll give you a few examples and I want you to learn from this. This is not a medical talk. This is more of a talk for you to really re-examine what you're doing in your life, look at your food and see what you can change for yourself and your family. Because if you don't, you're looking at diabetes and diabetic complications, heart disease, and Indians are also #1 for neurodegenerative disease compared to any other ethnic group in the world. So having said this, I'll tell you a few stories of my success stories from what I learned from them. There was one lady who was 93 years old who was brought into my office in a wheelchair. And her daughter brought her in, and she looked up at me and said, I want to do your diet. I looked at her, I said, you're 93, you're in a wheelchair. What do you mean you want to do my diet? I said, okay, I'll give you my book. I gave her my book. I said, I'll give you a list of recipes, what to eat and what not to eat, and this is what you need to do. Well, she took it to heart, and guess what happened? She lost 160 pounds, got out of the wheelchair, started walking with a walker, then with a cane. Then she actually started climbing flight of stairs. At 96, she was climbing stairs, and she died at 97. But she died at 97 because she had bowel obstruction, and nobody had picked that up. But the point is, how did a 93-year-old lady get off the wheelchair, lose weight, reverse diabetes, get off 14 medications, and climb a flight of stairs at 96? That's one. Second patient, this gentleman was at 77 years old. He had aortic valve replacement done. He had bypass done. Subsequently, he developed some infection. And long story short, he had to spend 6 months in different ICUs in the hospital because of infections. So by the time he got home, he didn't have any family to support him. And he had a tube in his stomach and a tube in his bladder, and he was shipped home. And he had a girlfriend who was 82 who would just come and check on him. So now, here's this guy going home with no support, and I thought this guy is dead. 6 months later, he walks into my office and does a squat. I looked at him and said, Mr. Cooper, I thought you were dead. He said, a lot of people thought I was dead. I said, how did you manage to do this? So he said, Monday, Wednesday, and Friday, the rehab ladies would come to my house and work with me, 15 minutes a day. So I said, 15 minutes a day. How did you manage? He asked me, how many hours do you think I rehab? I said, maybe 2 to 3 hours. He said, no, 10 to 12 hours a day I did rehab. And he recovered his health and stole life from death and went on to live up to 86. But after that, he moved. So I don't know how much longer he lived. But the point is, what is the second message you learn from this story? Third, 67-year-old lady, Caucasian lady comes in, diabetes, obesity, sleep apnea, hypertension, hypercholesterolemia, atrial fibrillation. She was on 17 medications. She had a tremor in her right hand for 40 years because of a motor vehicle accident, and she could not write or sign checks. And she had neuropathy, breast cancer survivor, chemotherapy, bladder incontinence. So she comes in, sits there, goes through my diet, cries and says, I've done this to myself, I'm going to change my diet. I said, fine. She changes her diet, comes back 13 days later, has lost 13 pounds. Good. Okay, you say, oh, maybe water loss or whatever it is. Then she says, I've dropped 15 medications out of 17. I said, okay, good. Maybe just luck, whatever it is. Blood pressure normal, off medication. Blood sugar normal, off medication. Sleep improved. She would get up in the morning with symptoms of mucus production, all that dissolved. And in less than 2 weeks, her symptoms of neuropathy had changed. So I said, I'm just thinking, okay, maybe it's just fluke, something happened. This was many years ago. So finally, she looks at me and said, look, guess what? Even my tremor disappeared. I said, a tremor which she had for 40 years disappeared? Then 2 months later, she comes back and says, I need to make a confession. I said, what? My bladder incontinence, which I had for 15 years, disappeared. That's interesting. So what do you learn from this? Not that I'm a miracle worker. All I learned from that lesson was, if you give the body a chance to heal, it will turn around and heal in less than 2 weeks to 6 weeks. That's point number one. Two, we make the same mistakes every day and expect a different result. And this lady, by just changing the course, was able to correct most of her problems in less than 2 weeks to 4 weeks. The point being, we never ever stop to see what we are doing wrong. We never find out what we are doing wrong. And even after finding out what we are doing wrong, we never correct it, but we always expect a different result and expect that the medications will fix the problem. But it never does. Another patient, 70-year-old gentleman comes in. I had deployed a stent in each artery. There are 3 vessel stenting. In those days, it was still new. Everybody was going for bypass, but since I was trained at Texas Heart, I decided to stent all the 3 arteries against the conventional wisdom back then. This was 20 years ago. So, or 22 years ago. So this guy, so by then I had learned that if your cholesterol is high, you're going to have heart disease. If you ever get your total cholesterol less than 150, and if you get your LDL less than 100, preferably less than 70, even before the studies had ever come out, I said you could slow down the progression of heart disease. If your total cholesterol to good cholesterol ratio was less than 3, you will not have heart disease, because dogs never have heart disease because their total cholesterol to good cholesterol ratio is less than 3. So armed with these ratios in my mind, I said, I'm going to start working with patients to get their numbers as low as possible. So in those days, most physicians would put patients on one medication. I was doing polypharmacy. I had 4 medications on board: niacin, Velcol, bile acid sequestrant, statin, fenofibrates, fish oil, everything I could lay my hands on and put it on patients and get the numbers down. The goal was to raise their good cholesterol higher than bad cholesterol. No physician had ever thought of it. I had more than 2,000 patients with good cholesterol more than bad cholesterol. Now remember, everybody talks about just bad cholesterol less than 100 or 70, and that's it. I'm changing the ratio here. I'm just basically changing the numbers here. So I thought I've done this, and now I'm able to stop the progression of disease. Guess what happened? The same patient who had 3 stents put in, for years I would look at his advanced cholesterol testings. All his advanced cholesterol labs were perfect. His good cholesterol was 80, his bad cholesterol was 20. Then one day he comes in and his wife says he's a little short of breath. So I said, okay, let's do a stress test. 2 years ago, we did a stress test in nuclear. It was normal. So we did a stress test, and guess what? A 30% heart in the back was not getting blood supply. So I took him back to the cath lab, and I realized that all his 3 arteries had blockages distal to the stents. So I sent him for bypass, but even after bypass, he never made it because at the time when I cathed him, his heart function dropped to 30%, and he later died. But what do you learn from this again? Just by getting on medications, and in fact, he was not on 1 medication, he was on 4 medications, and having a good cholesterol of 80, bad cholesterol of 20, he did not stop the progression of disease. And he continued to form disease, ended up with bypass, and died. So, what do you learn from all these things? Well, what I learned from this was medications was not the answer. That means I had to go back and re-examine and do reverse engineering, find out what I was doing wrong and what the patients were doing wrong. So, well, I started investing in lifestyle and diet. So I said, what is lifestyle and diet? Does anybody know lifestyle and diet? Every physician tells the patient, change your lifestyle, change your diet, and you'll do fine. Does anyone know what lifestyle is? Does anyone know what diet is? Does anyone know what you should be eating? Forget your patients. Does anybody know what your kids should be eating? Anybody? Should I be a vegetarian? Should I be a non-vegetarian? Should I be a keto guy? Should I be a non-keto guy? Should I just purely eat carbs? Should I just eat fruits? Should I just eat eggs or just vegetables? Or what should I be eating? Or what should I be telling my patients to eat? And why are Indians having so many problems, especially when we claim that our spices are very full of antioxidants? And why is it that Indians are having heart disease when they say that, oh, Chinese are drinking green tea, we drink black tea, and tea has got a lot of antioxidants. In spite of tea and spices, why do we have so many problems? Any answers on lifestyle and diet? No answers? Well, this is what I found out. Lifestyle and diet has 4 components or pillars. One is sleep. If you don't sleep well and you don't master sleep, you cannot, you will not, and you shall not have good health. Second is stress, not diet, not exercise. Second is stress. If you don't know how to live life without stress, you cannot have good health. Third is right food. Right food doesn't mean calories, portion size. It has nothing to do with calories, nothing to do with fat, nothing to do with cholesterol content of the food, nothing to do with portion sizes. And the last one is gut bacteria. What are you doing to protect your gut bacteria? These are the 4 pillars. If you mess with any one of these pillars, but the most important is the first pillar is what? Sleep. If you mess with this, you are not going to have good health. So, okay, this was my working concept. So this is what I'm going to do. So I'm going to pose a challenge for the team here. If you go to California and drink a cup of coffee, they'll tell you that you are eating or drinking a product that puts you at risk for cancer. Why would they say that? Second story, they found a body in Europe, dead, of course, dead because it's a body. They ran the body through a CAT scan and found that the person had severe calcium buildup in the arteries. Okay, if you have so much calcium buildup in the arteries, the next question was, what was the age of the person who died? They said it was 37 years of age. Then the next question was asked, how many years ago did this person die? They did carbon dating and found that he was dead around 5,500 years ago. Can anyone explain why would a guy 5,500 years ago at age 37 have so much calcium buildup in his arteries? Was eating a lot of cakes, cookies, candies, pizzas, cheesecakes, desserts, processed food, yet he had so much plaque buildup. Third, animals eat meat, no heart disease. Animals eat vegetables, no heart disease. Chinese eat meat, no heart disease. Chinese eat vegetables, no heart disease. Caucasians eat meat, heart disease. But when Caucasians become vegetarians, they don't develop heart disease. Indians eat meat, develop heart disease. Indians eat vegetables and are strict vegetarians, and some of the strict vegetarians have had the worst heart disease I've ever seen. Why is that? Is it genetics? Yes or no? Anybody? Either I'm so good or I'm so bad.
I strongly oils we get it in India, they're the major culprits.
You're partly right. What do you mean by cooking oils we get in India?
Oils in the sense, say for example, all the processed oils, what we get in the supermarkets, like the sunflower oil, like the safflower oil, and the gingerly oil and all, they're all commercial oils. They're all chlorinated. Not only chlorinated, they have a list of all chemicals included in them. With your apologies to the oil industry, I'm telling you the truth.
So I'm going to ask you a question. If I drink that oil, will I develop heart disease? Yes or no?
The thing is that we don't drink oil in India. We use it for cooking.
Hmm.
And the amount of oil we use for cooking is very judicious, especially on the non-vegetarian items. And even the vegetarians also, for the fries and all, they use quite a lot of amount of oil.
Then do you really think the oil is the culprit or something else is the culprit?
Oil is a part of it.
Okay, you're partly right. I'll answer the question later. So I'll come back to that. Now, two more stories and then I'll tell you something else. There was a famous TV anchorman by name Tim Russert 20 years ago. So he was 50 years old. He went to a cardiologist like me, got all the cardiac workup done, was completely normal. He was on a cholesterol medication, even though he had no family history for heart disease. And his total cholesterol, not bad cholesterol, his total cholesterol was 120. After 6 weeks, he goes to Italy for his son's graduation. Now, if I'm Tim Russert, I'm loaded with money, and I go to Italy for my son's graduation, I'm going to eat. So he ate well. And then day 6, he flew from Rome to New York. Day 7, he walked into the boardroom. A plaque in his widowmaker cracked, closed the artery, and he dropped dead of a massive heart attack at age 50 with a total cholesterol of less than 120 when his father, 84, was still alive. Something to remember. Second, Bill Clinton. At the same time, Bill Clinton comes from a family where every family member, male member, by 55 had either heart disease, heart attack, or death. Bill Clinton also had heart disease. He went for bypass. And then 3 years out, at the same time when Tim Russert died, he had an issue with his heart. He was in the hospital and he had a stent placement. After that, he woke up and said, I am done. And here is a gentleman who has a known genetic history and a documented history of heart disease and bypass, and later on has a stent. And he says, I'm changing my diet. And he changes his diet. To this date, almost 20 years out, he has not gone back even once to any hospital in US for heart treatment or workup. What was the difference between Tim Russert and Bill Clinton?
Clinton has changed his diet. He's completely become a vegetarian. Since then, his health has improved considerably. That is the reason why we never got back.
You're correct. And that's why I said when Caucasians are non-vegetarians, they have heart disease. But when Caucasians become vegetarians, they don't have heart disease. But why do Indian vegetarians have heart disease?
So the kind of clarified butter, they use it in the form of ghee, which is not exactly, it's not pure, but it's all adulterated. It is one of the reasons.
Hold the thought. So now, can I show those two slides? I don't know. No, go to the first one. No, other one. There should be another slide. అది ఉందా మీ దగ్గర ఇంకోటి calcified plaque ఉంది. Okay, look at this. If you can see this one. This is one. Oh, okay. Yeah. Yeah. Can you see this plaque? Yeah. Okay, can you see this plaque? So this is the carotid artery, and this is a carotid intima media thickness plaque. And this guy was like 53 years old. And see this plaque here? See the chunk of plaque here? This is what we call as a little bit of soft plaque, and he's got some other calcified plaque here. So can you move to the next slide? Next. Yeah. The same guy, he was on low dose cholesterol medication, Crestor 5 milligrams, but he was also on something called Vasipa. Vasipa is a prescription only fish oil in US. It's not available anywhere else in the world at this point. So on that medication, in less than 6 months, most of his plaque disappeared. Can I show the other slide? Or okay, in the meantime, let me talk. So what is Vasipa? Vasipa is a prescription only fish oil that's available in US. So everybody knows that eating fish is good for health. And eating certain kinds of fish gives you omega-3 fish oil. So when you eat cold water fish, you get omega-3. And omega-3 is usually composed of two different fish oils. One is EPA only, another one is DHA. So when you eat fish, cold water fish, you get EPA and DHA. So as long as you're eating those fish oils, you feel that you're doing the right thing to help against heart disease. So for last 50 years, they looked at omega-3s, fish oils, and heart disease and found that it really didn't help with heart disease. But somewhere along the line, the Japanese figured this out, that if you take fish oil and separate the EPA component of it and delete the DHA and stick to the EPA only, if you give that to a patient, they can shrink plaques and prevent heart attacks. This they figured out 40 years ago. And this is something they've been practicing for the last 40 years. Even though Japanese eat a lot of fish and their levels of omega-3 are very high in their system, in spite of that, by just making this change of adding EPA only, they were seeing a significant improvement in their health. And rule 2, for whatever reason, they decided not to share this with the rest of the world. They would sell everything else to the world, but they never sold this concept to the world. About 12 years or 15 years ago, a Sardarji PhD doctorate guy in London somehow came across this. And he went to Japan and perfected the technology of separating EPA and DHA and patented it, and somehow got the blessing of the Japanese authorities and started a company. And the company was bought out by Irish company, and they set it up in US. So once it was set up in US, they started making the EPA only fish oil. And they went to the FDA and said, look, the Japanese have done all these studies. The US government said, we don't care for Japanese studies. We want you to do your own studies. About 11 years ago, I got exposed to this product, and the drug rep who happens to be pushing this medication was a good friend of mine. So he comes to my office and says, look, you need to try this fish oil. By then, I had thousands of patients on another prescription fish oil called Lovaza, and on every patient who came to my office for the last 20 years, I would check their neck artery. I never saw a significant improvement or shrinkage in a plaque in all the thousands of patients I've seen, in spite of being on multiple cholesterol medications, polypharmacy, and fish oil with EPA and DHA. Now, he came to me and said, you have to start the patient on this medication. I said, in order to make him happy, I said, I'll start. So once I started, what do you think I noticed? I started realizing that most of the markers for inflammation would drop back to normal in less than 3 months. Now, in the past, I never saw this change in the inflammatory markers. 2 is their cholesterol number started to improve. 3, their plaques in the neck artery started to improve. 4, in the last 11 years, I'm yet to see my first patient on Vasipa and simple diet come in for a plaque rupture and heart attack, almost 0. Is there any other medication you can think of that does such good work? So then I started looking more into this. I started looking at the cell membrane ratios. That means I'm made of 10 trillion cells. Every cell has a membrane, every cell has a nucleus, and every cell has a mitochondria. The nucleus is the gonad for the cell. The cell membrane is brain for the cell, and the mitochondria is the liver for the cell. Now remember, the nucleus also has a membrane, the mitochondria has a membrane of its own, and the cell has a membrane of its own. Now, if you look at the cell membrane, it's made of a few fats. One is, it's made of 1% carbohydrate. It's made of about 30% to actually 39% protein. and the rest 60% is fat. Now, of the 60%, 40% is saturated fat, and every physician tells you don't eat saturated fat. But if you look at the cell membrane itself, it has saturated fat. Then the other 60% of the 60% liquid fat is monounsaturated fat, omega-6, and omega-3. Now, if you look at every one of us, you will notice that your saturated fat ratio will never change. Your omega-3 is very low because it is an essential fat and you can only get it by eating it. And your omega-6 will be very high and your monounsaturated fat will be borderline. So when I started this treatment, I started looking at every patient's cell membrane ratios. Then I called one of the ratios, Bill Harris, and I asked him, hey, I heard that the Japanese have a ratio of 1:1:1. That means 1 of omega-3 to 1 of omega-6 to 1 of omega or monounsaturated fat. He said, I've never seen this in Japanese, but I've seen this only in dolphins where they have 1:1:1. So when he said that, I said, I may not be able to see that. But when I started putting patients on Vascepa, in less than 6 months, I had already seen 10 patients who had 1:1:1 ratio of omega-3, omega-6, and monounsaturated fat. And from that point on, when I start getting everyone's ratio to that levels, their plaques started shrinking. Their skin started changing. Their blood pressure started dropping. Their kidney function started improving. And it's amazing that their cholesterol numbers started to drop. All these changes were happening very quickly. And if they threw in a good diet, their numbers got even better. So then the question comes back is, well, if I eat the fish, can I get that? No, because what I learned was on the Lovaza experiment, if you eat anything with DHA, it destroys the beneficial effects of EPA. The only way you can get all the benefits of EPA is to delete DHA from your diet. That is contrary to what the whole world tells you. The whole world tells you, go for DHA, go for DHA, it's good for the brain. I'm telling you, go for EPA. So this is what I had learned about 10 years ago, and gradually now all the studies are supporting that. Now they're saying that DHA is bad for you. 2, DHA actually prevents the beneficial effects of EPA, and EPA shrinks plaque, EPA drops heart attack. Then they did another study. This came out about 3 years ago, but by then I had already gotten all the information. So what they did was they took 2 groups. One group was put on statin, another group was put on statin and Vascepa. Both of them had CT angios done, and they found calcification. So they looked at calcification score, they looked at the plaques in the arteries, soft plaque. Now the statin group, after 18 months, their calcium score got worse, and their soft plaque got worse. That means statins did not work. The other group, which was on statin and Vascepa, the calcium score did not budge, and the soft plaque shrunk. Now, do you think the statin did the trick or the Vascepa did the trick? Now look at this one. Here is a gentleman who is not on a statin, who refuses to take a statin, and this is his carotid IMT, and his coronary artery calcium score was 1241. Now, I have done thousands of calcium scores, and I learned from them, and I learned that you cannot get rid of calcium once it's in the artery. So I told a lot of my patients, it's like dead plaque, it's like a cemetery, and nobody's going to clean the cemetery. But here is a patient, about 8 months ago I saw him. Look at the plaque. This is 14 months ago, and this is 14 months later. See here? See this plaque here? Look inside. All this started changing, and his calcium score dropped to 879. I still don't believe this, so I told him this calcium score scan was done in Colorado, and this was done in Houston. I said, I want you to go back to Colorado, go to the same place where you had the CAT scan done, and I want to see if the number truly dropped. And now, if the number truly dropped there, this is phenomenal. To be able to accomplish this in less than 14 months without a statin. Any questions so far? So coming back,
Is there any distributional change in the fish? Not a, where these fats are deposited, and they are in the fat packing the same. I think the fish meat.
Basically, the fat in the fish is what you're getting from. So even the company extracts the fat from the fish, from the cold water fish, and basically they're getting is EPA and DHA. Now they take that and separate the DHA out and purify the EPA. So when I eat a fish, salmon, raw, what am I getting? I get EPA and DHA. When I take the same salmon and put it in an oven and bake it, what am I getting? Oxidized EPA and DHA. When I heat it, I'm oxidizing the fat. When I oxidize this essential fat, what happens? It becomes toxic to me. When I fry the salmon, what am I doing? I'm destroying the EPA, and when I consume that, what happens? It is more toxic for me. But even if I don't do it, if I just go and take over-the-counter medication, I get EPA, DHA, and a filler. Now, if you get EPA, DHA, and a filler, the filler is useless for me. Most of the fillers are saturated fat, which will raise the cholesterol. The DHA blocks the beneficial EPA. And two, since it's not FDA regulated, you don't know how much of the EPA is oxidized and not oxidized, because anytime you look at or smell the fish oil, it should not smell fishy. If it smells fishy, it is already oxidized. So this company perfect the technology of making EPA only without oxidizing it and keeping it with almost shelf life of 10 years. So that's what. So coming back to the question, in the fish distribution, it's in the fat. Fish cannot make EPA and DHA. Cold water fish eat the planktons, which generate the EPA and DHA, and the fish gets the EPA and DHA. Why does a cold water fish need the EPA and DHA? Because it is nature's liquid antifreeze. When the temperature drops to -30, if you had saturated fat like catfish in the fish, it would become rock solid, it would sink to the bottom. Whereas this at -30 will still be liquid and prevents the fish from freezing. That was the nature's way of protecting the fish. But the fish doesn't make omega-3, it comes from the planktons and we consume it, but still DHA does not help unless you take the DHA out. Does it answer your question or did I confuse you more? Yeah.
So did they look into, you mentioned 50 varieties of cooking of fish, which changes the fat into the isolate fat. The traditional Scottish mountains and others where they eat a lot of fish, they prefer smoked salmon, where it is not completely grilled or cooked. It is weather dried.
Right.
And just smoking will be there.
Right.
Did anybody look into that category of cooking? Whether
I'll put it this way. When you put onions outside, what happens to them? They change color. When you put potatoes outside, what happens? They change color. Put avocados in room temperature, what happens? Change color. When you put onions in water and boil them, what happens? Even after 24 hours, it doesn't change color. You take the same onion and put in oil, what happens? It changes color. What does a change of color mean to you? Oxidation, right? So even at room temperature, dry air can also cause oxidation. Same thing can also happen to salmon when exposed to smoke. So any way you cook it, you are going to cause oxidation of the essential fat. And once you oxidize it, it's going to be toxic. Does that answer your question? Yes.
Say that the Chinese and the Japanese consume only EPA-rich food?
No.
How are they getting-
The beauty of this is the Japanese never told the Chinese what they found. Rule 1. 2 is the Japanese kept it a secret even among themselves and didn't tell the rest of the world. 3, the Japanese were eating EPA and DHA in the fish they were eating because they eat sashimi or sushi with raw fish. 4, they were, in spite of their omega-3 levels being exceptionally high, they would still take the EPA, and even at that level, they were seeing the benefit. That's next. But when I saw in my practice, when I took the DHA off, the benefits were even more aggressive. I did an experiment of myself eating 10 to 14 eggs a day for 10 years, just to prove a point that eggs don't kill. So what did I learn from that? Eating 10 to 14 eggs a day with yolks does not raise your cholesterol. And I used to eat them raw or poached. It does not cause plaque formation. It does not cause inflammation. But when I was eating that many eggs, I had to take 8 grams of Vasepa to raise my omega-3 levels because of the omega-6 I was getting from the egg yolks. It was burning up all the EPA I was eating in the form of Vasepa. So I had to actually double the dose. And then I realized that when people were on vegetarian diet, even on 2 grams of Vasepa, their numbers were better than mine when I was eating eggs. So the point is, be careful of what you're eating and how you're eating. And if you're worried about eggs, eggs don't kill. But if you eat eggs fried, they kill. I'm getting to the point of what you said. The point is simple. If you eat anything packaged, processed, fried, air fried, roasted, baked, sauteed, grilled, will cause oxidative change in the food. Once you cause oxidative change in the food, you cause inflammation. That inflammation triggers plaque formation, heart attacks, cancers, dementia, and strokes. And if you want to avoid all these, the one thing you have to do is avoid foods that cause inflammation. Then how should I eat? Anybody?
Does not to eat a banana.
No. How should I eat? What to eat and how should I eat? I just took everything and threw everything out. And that's basically every Indian food you're eating. So how should I eat and what should I? If you learn this, this is a valuable lesson. You will not even get if you pay $1 billion, because nobody has ever figured this out or talked about it. And nobody's even talking about it. So let me ask you a question. I just told you, I threw the packaged food out. I threw the processed food out. I threw the fried food out. A lot of Indians in Houston are air frying their food because, oh, it takes the fat out. It's excellent way. I can make chicken drumsticks on air fryer. It's so good and delicious, okay? I threw the air fryer out. I threw the grilling out. What about all the fried onions you're putting on your biryani and halim eating? And the guy who picked us up from the airport said in Hyderabad, they go to the hotel and go to the hospital. They go to the hotel and they go to the hospital. I said, why? Because look at this restaurant. Look, at 3 in the morning, they're eating halim and nihari. I said, so how should I eat my food?
It is the best gastronomical city of the world.
Yes. In fact, in 1985, I was doing my last year of medicine at Gandhi, and this gentleman had come back from UK, and he had finished his surgery training, and he was trying to set up a CT program in Gandhi. I looked at my friends and said, this guy is going to starve because I don't remember seeing a single patient with heart disease. Fast forward by 1993, what happened? Hyderabad was #1 for heart disease. How did we go from no heart disease to #1 in the short period of time? Can anybody answer the question? Or more than that, what should I eat? Come on, I gave you a simple answer, explanation.
Ready bread.
You can get it.
You know what our grandparents, the traditional, what they ate, the ancestor, that was the best kind of food.
But you didn't answer my question. What should I eat and how should I eat? I agree with you. I'm not disagree with you. But you have not pinned the statement.
Whatever you grew out, but it depends on from person to person in genetic makeup. See, I eat all the junk and I have 2 CT coronary angiograms. I don't have diabetes, I don't have hypertension, I'm 52, I've got no coronary disease. So you cannot generalize.
No, that's why when you look at the bell curve, there are always exceptions. But if I mirror my life with the exceptions, I'm screwed. So I can't do that. So you got to go back and see what am I doing wrong. So let's start again. What am I doing wrong, or what is the right food to eat?
The right food to eat is that you have to eat all too much of.
Who said raw food? Good, raw food.
Raw
And
food and then just steamed food.
Steamed food, excellent. Now we're getting somewhere. What else?
Steamed food, and then you can have this, what do you call this? Double boil is what we call it in India, which is not much of a cooked.
Yes, what else? You're on the right path. What else? Come on, use your imagination. Okay, I'll simplify it. Anything you eat has to be raw or cooked in water. When I say cooked in water, it has to be steamed or slow cooked in water. That means it has to be covered in water and slow cooked, or boiled in water, or pressure cooked in water. That's it. When you do this, you do not cause oxidative damage. And as long as you don't have oxidation, you're avoiding all these problems. It's a simple thing. So I went to Kerala and I realized something. Growing up, I realized, and going through residency, I realized that articles were coming out saying that Malayalis, Punjabis, and Gujaratis were #1 in the country for heart disease. So then when on a trip, I went to Kerala and I realized something. There are villages where all these old Keralites are walking around. but their kids and grandkids were dying of heart disease and accelerated cardiovascular disease. And same thing that is happening in Hyderabad was happening in Kerala much before. What was the difference? Can you explain? You answered it, but what was the change? The old Malayali families, first they put in water, put the food, and they only use salt, black pepper. They cooked it in water, and then in the end, added coconut fat or whatever fat. They cooked it for 5 minutes and ate it. On this diet, it is not a low-fat diet. It is a high-fat diet. Yet, they had no inflammation. Now, the next generation, what did they do? They reversed the process. First went in fat, and when I said, you said fat, fat is a tool used to raise the temperature. That's it. The water temperature does not go beyond 100 degrees centigrade, whereas the oil can take it to almost 300, 400 degrees centigrade based on the temperature you want to take it to. And that means fat is used as a tool to transfer heat. And once you transfer heat, you change the composition of food by causing oxidative damage. And that oxidative damage is what makes the food very tasty, but toxic. And that one change is changing the whole legacy of Indians. So there are two things Indians are doing wrong. One is called T square, meaning one is what? Tea, chai. Second is what? Tea, tadka. Chai we got it from the British, and tadka we got it from the Mughals. And that too, these two combinations is what is destroying the Indian psyche. And that's what I'm seeing in Houston. All the Indians who come in, they're plagued with TNT. And once you take that off, life changes. So I'll give you another example. 72-year-old Indian male comes in with diabetes, hemoglobin A1C is 10.6. Coronary artery disease, how? We did a nuclear stress test, which was abnormal, sent him for a cath, and he had 3-vessel disease. He had peripheral vascular disease. How do we know that? Because his CT angio of the legs was abnormal, and he was having claudication symptoms walking. And he had high blood pressure, and he was on multiple medications. So I set him up for him to go and see his primary care doctor to get on medications and also go for bypass surgery. He refused to go for bypass surgery. He comes back and says, I don't want to go for surgery. I want to change my diet. I said, look, if I put my neck on the line, if something happens to you, I'll lose my license. But he said, no, I don't want to go. So fine. A year ago, he changed his diet. In less than 3 months, he dropped his hemoglobin to less than 5.3. Blood pressure normal, no medication. Blood sugar normal, no medication. Coronary artery disease, still walking 5 miles a day, only on Vasipa and 5 milligrams of Crestor. Peripheral vascular disease, no symptoms of claudication, walking 5 miles every day. How did all these changes happen so quickly? Just changing the diet. So the next question comes back is this the same diet I can eat for diabetics? Anybody? Indians are number one for diabetes. What do we?
Yes.
Wrong. Diabetes, there are only 3 variables. One is caffeine. If you're on caffeine, your incidence of diabetes goes up, even though caffeine has no calories, but caffeine. Rule 2, if you eat anything that is sweet to the tongue, it will start the process of insulin resistance and later leptin resistance, and then leads to obesity and diabetes. And rule 3, once you start the insulin resistance, starch makes it worse. After thousands of patients, after dissecting and spending countless hours, I figured this combination out and said, oh, I'm a genius. I figured it out. You know what? I'm not a genius. In 1962, there was an article written where they said, sugar change, when I say sugar, I'm talking about fructose. Fructose changes the liver, which means fatty liver. Once a change happens in the liver, every time you expose the body to starch, that is glucose, thank you, the body responds differently. Meaning what? When you eat a lot of fruits, what does it cause? Anybody? Do fruits cause heart disease? Yes or no? No, they don't cause heart disease. Do fruits cause dementia, inflammation? Yes or no? No, they don't cause. What do fruits cause? They cause diabetes. Why? Fruits have fructose. Fructose causes fatty liver. Fatty liver leads to insulin resistance. Insulin resistance leads to diabetes. And when you have insulin resistance and you continue to eat starch, what happens? You develop leptin resistance and you also develop obesity. And which ingredient starts the whole process? Fructose. So that means, are fruits innocent? No. If you give your kids a lot of fruits, what are they going to be? Fat. And in the down the road will become what? Diabetic. So there are two sides to a coin. Heads, you want to avoid diabetes, stay away from caffeine and anything that is sweet to the tongue. Once you have diabetes and you want to reverse diabetes, eliminate caffeine, eliminate anything that is sweet to the tongue, and refuse to eat anything that has starch until you reverse diabetes. Like this gentleman, once he reversed diabetes, now he's back on starch, roti dal chawal, without raising his blood sugar. But once you have diabetes, no matter what you do, if you eat a little bit of starch, it is like pouring gasoline on fire. Fire is fructose, that is sugar. Gasoline is glucose. Once you start the fire, every time you add glucose, what happens? Your fire gets worse. And that's how you end up having diabetic complications. There is nothing you can do to reverse it if you keep eating starch, no matter how many miles you run. Now come to the second size, the tails. If you want to avoid heart disease, it has nothing to do with sugar, caffeine, or starch. Starch does not cause heart disease. It is inflammation, and inflammation is caused by eating oxidized food. That means as long as you refuse to eat oxidized food, you will never have to worry about heart disease. Now coming up to the first question. Coffee in California, why does it cause cancers? Because coffee is made from what? Roasted coffee beans. And when you roast, what happens? You change the chemical composition, and they said because you increase the acrylic acid, it puts you at risk for cancers, which is the same process that also puts you at risk for inflammation, plaque formation, and dementia. Well, what happened to the body in Europe? He was found dead and 5,500 years ago. What was he doing? If you go back into history, how were they cooking their meat? Over fire. When you cook your meat over fire, what happens? Oxidized meat. When you eat oxidized meat, what happens? It causes inflammation, and that's how you end up having severe calcification. When people eat protein bars and protein powders, that also causes severe oxidation. Be careful. Packaged processed foods. Now, why don't Chinese have heart disease? Because they eat raw food or boiled food or steamed food. They don't fry like us. They eat the same ingredients like us, but they don't fry like us. They eat it raw or boiled. And what about Indians? Well, should I tell you what we eat?
Most of the time we fry.
It's everything we fry. Grill, fry, roast. Even the nuts we eat is fried. Even the pickles we have is tadka. Even the coconut chutney is tadka. Even the tomato chutney is tadka. Even the yogurt rice has tadka. Everything you touch has to have tadka. Even the dal you have is tadka. How can tadka help you? It is very tasty, but it's so toxic to your arteries and your brain. Well, Caucasians, how are they exempt? Well, when Caucasians eat, they always eat grilled meats or roasted meats or fried chicken, or they eat barbecue meats. When Caucasians become vegans and vegetarians, they don't do anything. So they're eating raw vegetables or steamed vegetables, and guess what? They have no heart disease. Now, if you change your diet and take Vasipa, what happens to your heart disease? Doesn't happen. Thank you.
If you don't mind, doctor, can I ask you a question?
You can ask all the questions until Guru throws me out. I'm here.
Nobody. I wonder what should we eat?
Oh,
No, so I think the question should be different. Question should be, how can we modify the Indian diet without losing the taste?
You can do that. You can do that.
You reduce that pigeon bird.
yes. No, it's very simple. If you want to kill your spouse, feed them fried food. If you love your spouse, then and you want them to be miserable living around you for a long time, give them raw and boiled food. They'll complain and whine, but they won't die. So it is very simple. So every time I sit down to eat, I ask a simple question. Am I eating oxidized food? It's very simple. If I'm eating oxidized food, I know what it's going to do. It's not going to cause diabetes unless I'm eating pecan pies, because now pecan pie is not only an oxidized food, but it's also going to cause diabetes. Am I making sense? So it's a simple question. What am I eating? Is it oxidized? If it's oxidized, I'm going to cause dementia down the road. I don't want it. Plaque formation, I don't want it. Heart attacks, I don't want it. Cancers, I don't want it. Inflammation in the body, I don't want it. So stay away from oxidized food. Now, if I want to avoid obesity and diabetes, what should I do? Stay away from caffeine and anything that is sweet to the tongue. If I do that, I don't have to worry about developing diabetes. If I have diabetes and I want to reverse it, what do? Stay away from caffeine, anything sweet, and quit starch until I get my hemoglobin A1C less than 5.5. After that, get back to eating rice. That means if I eat rice, beans, and lentils, am I ever going to die of a heart attack? Yes or no? No,
No.
you will not. Even if I eat meat only, but if I eat it boiled, am I going to have heart disease? No. You see my point? I am not being prejudiced against red meat or white meat, nothing of that sort. I'm not even talking about cholesterol. I said I ate 10 to 14 eggs a day without even hurting myself, meaning what? Eggs don't kill. So I thought I'm eating a lot of eggs. So when I came back a few years ago, the driver who my parents employed, so he and I were talking, and he said, I was doing weightlifting. I'm 28 years old, and I was eating 50 to 60 boiled eggs a day. I said, what? I said 50 to 60 boiled eggs. I said, how the first one eating 50 to 60 boiled eggs is a chore. Second, how the hell would you get 50 to 60 boiled eggs in a country like this? So he said, my mom works for the cantonment, the army, this thing. So she works in the kitchen. So at the end of the day, all the eggs are left. So she packs all the eggs and brings it home. So I end up eating 50 to 60 boiled eggs a day. And he did that for almost 2 years. Can you imagine eating 50 to 60 boiled eggs? But the point I'm trying to highlight is don't be scared of eggs. Now, patients come to my office and say, oh, can I eat the yolk? I throw the yolk. I said, look, I know friends who eat the white and give the yolk to the dog. The dog looks much more handsome than you. So the fur is nice and they're very nice because the dog is so happy to eat the yolk while these guys are looking skinny and miserable. So the point I said, look, now I said, every time you look at an egg and eat an egg, you feel guilty and that you might have heart disease. How many chicken have you eaten in your life? They become quiet. Oh, maybe hundreds. I said, how about thousands? Have you ever worried about eating a chicken dying of heart disease? No. Where did the egg come from? From a chicken? Where did the chicken come from? The egg? If the chicken didn't kill you, why would an egg kill you? Unless you fry it. Steam it, boil, doesn't kill you. Make sense?
Going by that, standard halim should be healthy because it's boiled throughout the evening. It's just lentils, meat, and a little bit of clarified tea on the top, and as long as you avoid the onions.
Yes, halim is healthy as long as you do that. But what do you do on top? You put fried onions. And then you mix it. They serve, and then yes. But if you do it the traditional halim, where okay, even the biryani, which is steamed meats, is not bad. So the point is simple: are you eating something oxidized? If you're eating something oxidized, you're in trouble. So I'm going to ask you a question now. That okay, rice, chapati, dal. Which one is better to eat? Rice and dal. You succeeded because every time I ask this question in the office, they say chapati. I said, I explained everything to you and now you're telling me chapati? How do you make chapati? Is chapati steamed? No. What are you doing on tawa? Chapati. So all the dark spots on chapati is what? Oxidized. So if you're given a choice, rice and dal is better than chapati and dal. Now next question. Dal versus tadka dal. Dal. Now, if I eat rice and dal, am I going to die up to the age of 90 or 95? No. If I eat rice, dal, yogurt, and boiled egg, am I going to die? No. You see the point how I'm taking you? Now, if I give you options, same dough, idli, dosa, vada. Now, chapati versus puri. Eating onions versus onion bhajis. Potatoes cooked with tomato slowly in water versus samosa. One samosa, Patrick Mason was a gentleman who works in Boston, and he did a lot of work with EPA. And he was telling me that if you eat one samosa, potato samosa, the markers for inflammation go up so high in your system, it is unbelievable in a very short period of time. And we have chai and samosa, chai and bhaji. Just think how much damage we are doing to our kids. If you want to change the trajectory. So I'll give you another story. One day my dad calls me and says, I am dizzy. I said, why are you dizzy? I don't know. I said, what's your blood pressure? Oh, I checked, it's 160. I said, your blood pressure is always low. Why is it 160? I don't know. I said, okay, go get an MRI. So he went and got an MRI. And I said, also get an EKG and an echo. So the MRI comes back and showing some early a shrinkage of brain. He said, oh, they said age related. I said, Dad, there's no age related shrinkage of brain. Brain is one organ that doesn't shrink if you take good care of it. Even you're 95, it still does a great job and it does not shrink. That means you are doing something wrong. I'm not doing anything wrong. I'm a strict vegetarian. I said, doesn't matter. Second, I said, you did an echocardiogram. It shows mild thickening of the heart muscle. That means your blood pressure has been high for some time. Oh, I don't know. I never checked it before. It also said that your blood pressure in the lung was slightly high, 42. Normal is less than 30. That tells me that you probably have sleep apnea. I don't have a problem with sleep apnea. I said, okay, you don't have it. So I asked him a question. I know my dad is strict vegetarian and does not ever drink alcohol. So I said, Dad, are you taking a sleeping pill? He said, yes, I'm taking a sleeping pill. Why are you taking a sleeping pill? Because I'm stressed out and anxious. I can't sleep. I said, you don't have any problems in life. And why are you stressed out? Come to find out, 4 years ago, he started drinking a cup of tea. And that tea was causing him anxiety and stress and insomnia. And 8 o'clock, he's a man of discipline. He has to sleep by 8:30. He can't fall asleep by 8:30. So he started popping a sleeping pill. And that sleeping pill was doing what? Causing sleep apnea. And that sleep apnea was causing what? His blood pressure to go up at night, causing damage to the brain. And his blood pressure was also going up in the lung. That was putting him up or setting him up for what? Atrial fibrillation. So had this not happened and he continued, what was the next thing that would happen? He would have woken up with a massive stroke because of what? Atrial fibrillation. All this started from what? A cup of tea. So I got on his case. I said, you got to give up a cup of tea. So my brother's on the conference call. He works for Apple. And he says, okay, Dad, I'm going to give up coffee. So my brother has been meditating for years. And I've been telling him, you cannot meditate and still your mind if you're on caffeine. You got to give it up. So he said, no, I'm going to do that. So finally, my brother said, I'm going to give up caffeine too. Then a month later, my brother calls me and said, something strange has happened. I said, what? He's 10 years younger than me. So I used to sleep 9 hours and I get up 6 to 7 times to pee. And ever since I gave up coffee, 1 cup, I don't get up at night to pee. 2, he said, every day in the evening, I would come home and spend 1 to 2 hours watching Netflix. Now, I'm not even watching Netflix. I'm very efficient and productive at work. And I go to bed and sleep 9 hours straight and don't have a problem. I said, you see how 1 cup of coffee does all those things? He said, I wish I had not done this. I could have accomplished even more. So the point being, small acts done often can lead to titanic shifts. So go back and re-examine everything you're doing. Remember I said that lady changed the course in less than 14 days, her tremor disappeared. Why? Everything we do sets up for inflammation in some way or form and never lets the body heal. By just changing the trajectory, everything changed.
Let me ask you a philosophical.
Ask me.
That is a scientific question. Almost 10, 12 years ago, the Harvard Epidemiological Department published a very landmark study for the New England of medicine. And all this hoopla or statin drugs,
Yes,
reducing your cholesterol, is ultimately adding on 2 years of life, what you're destined to live.
correct.
We know now the lifespan of an individual. Now, India is whatever, 75,
Right.
76, 80, 85, in some of the Western countries. And so all this, what you talked about at the end of the day, oxidative stress, caffeine, everything else, what is that adding on? What is that adding on to the life at the end of the day that you'll put yourself and be deprived of one life? You know?
That's a very powerful question. I'll answer the question. It is not the length of life I'm interested. It is the quality of life I'm interested. It is not the length of time I survive on this. It is how efficient my brain is working. It is how good my connections are. How many innovative things I'm able to accomplish. How am I able to feel pleasure and happiness within myself? How can I experience silence of the mind, actual stillness of the mind, and have zero stress? All this can be accomplished by changing the diet. If you can't, you will live to be 90, but you will lead a miserable life. Your job on earth is to live a pleasant, happy, beautiful, stress-free life and every hour of your life. And your goal should be, how do I evolve mentally, physically, spiritually, financially, family-wise, and professionally every hour, every day of my life? Every decision I make, how is it going to impact the next 3 to 7 generations? Once you start thinking, but you cannot think like that when you eat the wrong food, because even our Hindu philosophy said sattvic food, rajasic and tamasic food. When you disrupt the brain, your thinking changes. Once you change, one wrong thought can put you off on a wrong trajectory. So that's how I'm approaching it. I am not doing this to prolong life. I am doing this to only one thing, neuroplasticity. How do I change my brain? How do I evolve myself to be the best possible person I can be, rather than saying, giving excuses or complaining or criticizing or blaming or giving explanations.
This caffeine story, the recent articles, So what do you have to say about it?
All
virtues of caffeine, from
yes,
Alzheimer's to dementias,
yes,
to cancer prevention,
yes,
antioxidant. Now you are saying that completely.
Completely stop it. So after looking at my diet program is very simple. Anyone who joins my program has to pay a lot of money. But if they join the program, the first thing they have to give up is caffeine. If they are going to be on caffeine, it's not acceptable. And every person who has given up caffeine comes back and says, my sleep has improved significantly. Well, 2, my stress level has dropped dramatically. 3, my appetite has changed. I'm not hungry at all. I'm not even looking for snacks. 4, the spouse says his personality changed and there are less fights in the house. It's amazing how things change. So what is the first thing I said? If you want to improve life, what is the first thing you have to invest in? Master sleep. How will caffeine improve your sleep? It will not. Second thing I said, unload stress. Caffeine disrupts your life and causes stress. What's the third thing I said? Eat the right food. Caffeine makes you hungry and you're always looking for food. And most people in US, at least I know Caucasians, they drink a cup of coffee or tea in the morning and in the evening they have to drink wine to put them to sleep. And what does wine do? It disrupts everything. It causes sleep apnea. It causes high blood pressure. There's a lot of other things which you don't want, even though they say alcohol is good for you. And the recent study finally said any amount of alcohol is injurious to the brain. And when you know all these things, how do you disrupt all these things and bring it back to normal? Getting off caffeine. Caffeine causes vasoconstriction. Caffeine drops blood supply to the brain by 40% in less than 1 minute by causing vasoconstriction. Caffeine raises heart rate. Caffeine raises blood pressure. Caffeine raises your stress hormones. Caffeine causes gastritis. Caffeine dehydrates you because it acts like a pseudo diuretic. Caffeine causes restlessness when sleep, cause insomnia, and also in some people can cause nightmares and bad dreams. All these are different points, and every one of these can have a disruptive effect on your life. The ultimate goal of all life is what? Are you absolutely calm and still within? Are you able to get along with yourself? Are your thoughts so slow and quiet that you have complete control on your life? You cannot accomplish that if you're on caffeine. If you're on caffeine, try this experiment. Just walk away from caffeine for 1 month. Keep a diary and see what happened to your sleep. How happy is your spouse? How happy are your kids? What happened to your appetite? What happened to your dreams? What happened to your blood pressure and heart rate? And if you notice a radical transformation in your life, then don't drink it. But if you say it didn't change, then go back to caffeine. I can tell you another example. Patient, I told him about caffeine. He said, I'm going to give it up. I will give up caffeine. So he gave up caffeine. He used to drink 4 or 5 cups of coffee. After 3 months, he comes back. So I said, hey, did you give up coffee? He said, yes. Did you see any difference? I didn't see any difference. I said, okay. Some men say they're macho. Oh, nothing. It didn't make any difference. I said, good. Then he himself proceeds to tell me that, one day my employee was making some coffee, so I decided to have coffee. This is almost a month and a half later. So I drank 2 cups of coffee, and it was a little strong. I couldn't handle myself. I took the day off and went home. I said, well, do you want to drink caffeine again? He said, no. A Rice University professor was a Jewish professor. His wife came to me and she said, can you get my husband off caffeine? He said, okay, let him come. So the husband came to the office. He used to drink 12 to 13 cups of coffee. And he was 60 years old. And he said, I have to innovate and improvise because my kids who come to my school or college are so sharp that I have to be 1 step ahead of the game. So we talked about bad things of caffeine. And finally, he said, I'm going to give up caffeine. 3 weeks later, he comes back. I asked him, did you give up caffeine? He said, yes, I've given up caffeine. What changes have you noticed? He said, when I was on caffeine, I would spend hours on a project and it would go nowhere. The next day, I would realize that I was on the wrong platform. And this went on for years. But now, off caffeine, I never find myself on the wrong platform. I'm able to make decisions and get to the solution right away. Third, halfway through, after 1 week, he said he went back to caffeine just once. And he said the same thing happened. He again found himself on the wrong platform. So I asked him, are you going to drink caffeine? He said, no. I said, can you give me a testimony? He said, no.
So what's your take on the green tea?
Well, what's the difference between green tea and black tea?
no milk in that.
No, you can have neat black. So green tea and black tea are coming from the same leaf. Green tea is unfermented, black tea is fermented. That means you're getting basically the same thing, right? So I went to Munnar many years ago with my parents. So when I saw that, I saw beautiful tree plantation, thousands of hectares of tea plantations, and the leaves were pristine. So when you drive to Munnar, you look at the vegetation, all the leaves are eaten up with worms and everything else, and here the leaves are perfect. So I talked to the guide and said, how come the leaves are so perfect here and how come they're not? He said, we spray pesticides. I said, how? We spray pesticides every other day. I said, good. How long does a tree plant live? He said, 120 years. I said, what do? We harvest the leaves and ship it out. Now, when you consume tea and you boil your tea for hours, how many pesticides are you getting? Forget the caffeine part of it.
But also, from the we use green tea is okay, but then traditional non-tea teas are
I was hoping somebody would. Yes. When you want tea, why don't you try this? Take ginger, take turmeric, take black pepper, take lemon or lime, boil it. Don't use cinnamon. Cinnamon messes with your sleep and your brain and your thinking. No cloves, no cardamom. Don't mess with cinnamon, salt and black pepper. So boil these four and boil it for 15 minutes. If you want, blend them up, then boil it and then strain it, put it in a nice big flask and drink it all day long. It is not going to hurt you. One day, I had a lot of other things to cover, but I'm going to briefly say. So I wanted to build muscle. So I just started exercising in the office, and in between patients, I would go do push-ups. So finally, I got to a point I was doing 300 push-ups, 150 pound, 100 pound, 100 deadlifts, and 100-pound kettlebell, and one of those things I used to do. So I got home at 8 o'clock and I was exhausted, and I'm ready to go to sleep because I'm exhausted. So my daughter says, hey, Dad, I made some rice pudding. So why don't you try it? So I said, okay, I'm going to have the rice pudding. So here I'm eating rice pudding. I take one bite and I said, it tastes nice. And I said, what do you have? He said, cardamom. I put a little bit of cardamom. Good. After the third bite, my mind woke up and I could not sleep till 2 o'clock in the morning. What did I learn from that? Never mess with these spices. They will affect your sleep. Once I was eating, okay, I did the same thing, all exercises. I was doing fine. I came home exhausted. My wife had made some cabbage curry, and some green chili and some spices. I took one bite of the green chili. I woke up. At 12 at night, I'm trying to sleep. I'm restless. My mind is racing. So I get up and go drink scotch and still not able to sleep. At 2 or 2:30, I fell asleep. So after everything I'm telling you is something I've experimented myself or learned from patients. And what I learned was you have to make your life simple. You try to complicate it because you heard somebody else say it's good for you. It is going to butcher your life.
So all your coffee drinkers, what is the replacement you are suggesting? You need to do something.
There is no replacement for caffeine because caffeine is an addicting drug. Caffeine can cause, there's no different than addiction for caffeine or any other drug.
Why don't you give an alternative for the green tea with the turmeric? That's the best take on it.
I just told you, right? Instead of this, inject ginger, turmeric, black pepper, and okay. So, okay, a 93-year-old lady, she lives in Clear Lake. She used to live in Clear Lake, and she had been a patient for almost 20 years. She fell and broke her shoulder and her wrist. And the orthopedic surgeon said, I am not going to operate on her because she also has cardiac issues. I'm not going to operate on her.
They didn't have that Reddy.
I'm sorry, you should have been invited. So the family called me and said, what do I do? I said, look, I've heard some anecdotal stories of Indians when they fall, they take the turmeric and put in the milk and drink, and their bone growth seems to accelerate for whatever reason. But I don't have any proof on it. But you know what? Since she's in the ICU, there's nothing else to do. Try this. Get bone broth, beef or goat bone broth, make your own bone broth, put eggs in it, it's easy, and put some turmeric in it and give it to her. So she got bone broth, she got eggs and turmeric. Her son is a chiropractor, okay? So the orthopedic doctor said, I'm not going to touch you. And the physical therapist said, you will never be able to lift your arm, okay? 3 things happened. 1, she recovered at a much faster pace than any normal person would do. 2, the son, who was a chiropractor, looked at the films, couldn't believe that the mother at 93 was healing so fast. He took the x-rays and presented it it at his conference and saying, this is how fast my mother recovered. And 3, the physical therapist who said, you cannot raise your arm, she lifted her arm up and did everything. And the only thing I can attribute to it was the rapidity with which she healed, and that could be only because of turmeric and turmeric with black pepper. But do I have any scientific data? No. Have I seen this happen in other patients? Yes. Is it going to kill you? No. Is it going to hurt you? No. Is it okay to take it and do it every day? Absolutely.
But there's such a high prevalence of osteoporosis in daily tablet meters. Maybe.
So when I turned 32, 33, I had 3 stress fractures. So I was squatting once and had a stress fracture. I was walking on a concrete, I had stress fracture. I was trying to play racquetball with one of my colleagues from Baylor, I had stress fracture, and I suffered from pain. So I didn't understand why I was having stress fracture. So I went to the head of the department because one of my friends was working in MD Anderson. So head of the department, head of MD Anderson was an endocrinologist. I went to him and said, hey, I have issues. I don't know what's going on. So he did bone biopsy, he did everything else, all the workup done. And he said, well, I think you have lupus. I said, whoa, that's the first thing. I had lupus. Second, he said, your bones below the knee are so brittle that you have bones of a 90-year-old. It just depressed me. Now here I am at 33, 34. I'm told that I have bones of a 90-year-old. And he said, if you jump off that little stool, you're going to crush your bones in the leg. So he put me on Fosamax. So I took Fosamax for a year. But then I said, you know what, something's wrong here. So I'm doing something wrong. So finally, I stopped it, went through depression, finally changed. In the meantime, I was also told that I had lupus. So I had changed my diet. I've been working on different diets. And then as I noticed, as I evolved, I realized I didn't have any autoimmune condition when I changed my diet. So I did all the markers every year and all of them were negative. Fine, that's one. Second, at age 55, I said, you know what, I'm tired of living like this. I've never exercised all my life. I'm going to start exercising slowly. And in the office, not going to the gym, I started using kettlebells and weights. I started slowly. I got to the point where I could lift 100-pound kettlebells in both arms and walk in the office. That's how strong. I went from 160 pounds to 180 pounds muscle and bone. Okay, I did all this. And a year and a half later, I went to Utah with 2 other friends. And a friend of mine lives in Utah. So in Utah, he said, I want to go hiking. So, okay, let's go hiking. So I didn't realize that the hiking trail he took us on was the second toughest trail. So here I am with 180-pound muscle mass and trying to go up. I'm not trained for it. And I'm huffing and puffing and my heart is pounding. So all the way we go from 5,000 to 9,000 feet. On the way back, I'm looking at it. Every step on the way down is 2.5 feet and it's all gravel and my foot's hitting and twisting. So I said, I'm done because by the time I get down halfway through, I'm going to have severe fractures, one, crushed feet, and I'll have to call 911, airlift out. It's going to cost me $100,000. And I was dreading it. After 12 hours of hiking, I came down. There was no stress fracture. What did I learn from that? Weightlifting is the way to build bone. So my father, when he turned 79, he sent me the report and said, oh, I've got osteopenia and they put me on this medication. I said, don't take the medication. I said, start weightlifting. So he took my advice and started weightlifting. He's 84 years old. He pushes 110 pounds. He pulls 130 pounds. And when they did the bone marrow 3 months ago, all the negative markers became positive. And he was building bone, even at that age. So then I asked the question, how does a person build bone? If I eat a lot of calcium, will I build bone? Well, I started taking calcium, but the calcium doesn't get absorbed unless your vitamin D is normal. Second, so if I take vitamin D and don't take calcium, can I still have enough calcium coming from the hood? The answer is yes. But if I take vitamin D and absorb calcium, is it going to build bone? The answer is no. Then how the hell am I going to build bone? I have to take vitamin D, keep my vitamin D levels up, and start lifting weights. And only that way can you start building bone. But nobody does that. How many patients do you know who actually change? Now my patients are doing it and they can see the difference. But you have to take vitamin D, keep your vitamin D levels normal, and you have to lift weights every day to build bone. Not walking, not jogging, lifting weights.
Does the same thing.
Pardon?
Jogging does the same thing.
Not as much as lifting weights.
Basically, the will flow on the bone. Stay number 2. You stress it, it will become strong. And that's what the human body does.
Right. And
medication will not change.
I have a lot of joggers who also have severe osteopenia. That's why I said lifting weights is what I've seen the difference. When they change, everything changes.
True.
True? Yes.
You clubbed all the fruits into one group, or did you being the carbohydrate rich fruits, non-citrus type of?
I just said anything that is sweet to the tongue will give you fructose. The only fruits you can eat are cattle, CATL, meaning cucumbers. Not a people say it's not a fruit. Avocados, well, it's not tasty. Tomatoes, well, not cherry tomatoes because cherry tomatoes are sweeter. And lime and lemon. These don't have sugar. Any other fruit you touch is going to give you fructose. Even a small bowl of blueberries gives you 20 grams of fructose. And fructose is going to fry you. That's it.
So there should be a
Right, right.
Dried fruits are pure source of fructose. So this many grapes become this many raisins, and you pop these raisins, and next thing you know, you have fat. Okay, bears, grizzly bears, during fall when they start eating berries, small berries, right? They start eating a lot of berries. Why do they eat berries? Because once they start eating berries, in less than 3 days, their livers become fatty. Once the livers become fatty, what happens to their insulin resistance? The liver goes up. Once that happens, what happens to insulin levels? They go up. When the insulin levels goes up, what happens to your blood sugar? Drops. When your blood sugar drops, what happens? You become hypoglycemic. When you become hypoglycemic, what happens? You're hungry. When you're hungry, what do? You start going eating. So what do the bears do? They start eating. They gain 300 pounds. And then they go to hibernation. So if I were to go to Canada and wipe out all the berries, I'll wipe out all the grizzly bears in 1 year because they will not become fat. The same thing happens to humans. But the only difference is bears go through hibernation. Humans are eternally pregnant because during pregnancy, what happens? You go through leptin resistance. You deliver, leptin resistance drop. Whereas once you start the insulin resistance, leptin resistance, we will never reverse it unless you go through fasting.
One very important point. We are negating thousands and thousands of articles on the very same fruit. The berries that have been idealized, with the nature's best bountiful antioxidants, and proven studies, zillions of studies. How can you make such sweeping statement?
So when I say fruits, if you do not have diabetes, you can eat fruits in moderation once in a while, but not every day. That's point number one.
Which I've been doing for 5 years.
Right. Second, I'll tell you something which is interesting. Second thing, Dr. Reddy brought up a very good point, antioxidants. So you know what I tell my patients? Go to Whole Foods. I'm just talking about in America. Buy all the organic fruit juices. Now here I'm telling them to buy fruit juices. Bring them home. Take probiotic capsules. Open them and add it into each one of those, and leave it out there for 6 weeks. What happens? All the sugar gets fermented out. Once you ferment it, start having a shot of these every day. What are you getting? You're getting all the antioxidants of the fruits without the sugar. And you're also getting probiotics. So yes, that's how I ask them to take the fruits in the form of fruit juice fermented. But otherwise, I refuse to let them eat fruits every day because once you start the insulin-resistant fatty liver, you're going down the slippery slope. Second, a patient comes in after COVID, and the Hispanic male and female, a wife says, ever since COVID, he's been gaining weight. He already gained 30 pounds. COVID did something to him. I said, COVID doesn't do anything to make you fat. So first question I said, did your husband suffer a lot during COVID? Oh, yes. Was he coughing a lot? Yes. Did you give him a lot of cough lozenges? Oh, he was popping in cough lozenges all the time. Cough lozenges in US, 9 out of 11 ingredients are fructose or sugar. When you eat so much of that, what happens? Fatty liver. Once you trigger the fatty liver, what happens? After that, every time you eat beans and lentils, beans and rice, you're getting fatter and fatter and fatter. I told him, your husband is eternally pregnant. He's never going to lose a weight. So, one second. Wait.
My worry is now, how do I go home and convince my family member?
Okay, two requests. Two.
I really want to know in real world when it goes in, what is the percentage of adherence and how do we motivate and bring out this answer?
I'll answer that. Did you do a lot of video of me? Okay, I have one request. Please, do not put it on YouTube. Do not. You can share it with your family, but don't put it on YouTube. That's one request. Second, you're right. You know, I have thousands of Indian patients, and I don't let Indian patients join my program because they don't do it. This is what I learned, but Indians don't change. And that's why I said the two things that are destroying Indians are tadka and tea. But out of the thousands of patients who have in my practice, have any of the Indian patients changed? Nope. They're educated people, rich people, but refuse to change. See that if a Chinese walks in, he treats you like you're an Indian and walks away. An Indian walks in, he sits there, he asks you questions, and you're answering one question, he asks you another question. That means he's not even listening to what you're saying, and he goes away and comes back and asks me the same question. It's like, I'm a dumb idiot answering these questions. And when it comes to changing, he doesn't change his life. So that's out. Now, African American comes in, you tell them once, 50 to 60% of them change. Caucasian comes in, you tell them once, 50 to 60% change. Hispanics, about 30% change. Indians, zero. Chinese, he'll say you're an idiot and walks away. So it's interesting how each race ethnically how we think. It's not because we lack intelligence, but when it comes to health, we are so stubborn and ignorant that we refuse to change. So how do I convince my family to change? I'll tell you another story. One day my car was giving me trouble. So one of my patients is a driver. I called him and said, Galindo, come and pick me up. So he came to pick me up and I was late, 8:30. So he said, Galindo, I'm sorry. So he says, you're always late. I said, fine. Then he's take me and then he says, even God made mistakes. I said, what nonsense are you talking about? God made mistakes. He said, read the Bible. In the Bible it says, God told man, don't eat the apple. What did he do? He ate the apple. So if God cannot change man, who the hell am I to change you? I said, damn good advice. After that, I never advise my wife or kids. Because I am going to bang my head to the wall, but I will not make them change. So the point is this, when I tell somebody to change, they're not going to change. They'll listen to the next guy who tells them and they'll follow them. So when you go and tell your spouse, you are an idiot and you don't know anything, and they'll do exactly the opposite. So telling someone is never going to work. Only way you can do is lead by example. Change, lead by example. Don't preach, lead by example. That's what I do to my patient. I said, this is what I do. If you don't like it, don't do it. But this is what I do, lead by example. That's it. Yes, I'll answer that. Hey, oatmeal. Let me ask you a question. You heard this talk. Does oatmeal kill? Yes or no? No. When should oatmeal be avoided? Diabetics. 3, should you cook oatmeal style with tadka? Good. That's it. So don't worry about oatmeal. Oatmeal is not going to hurt you. You can eat oatmeal. So I did a study on myself. Everything I did a study on myself. A guinea pig, right? So I did oatmeal and dal. Oatmeal and dal, breakfast, lunch, and dinner for 6 weeks. My cholesterol was 330. My triglycerides were 300. Why was that? Because I was eating tadka dal. What does tadka dal do? So if I eat oatmeal and dal, my cholesterol would have been 160. My triglycerides would have been like 130. Okay. When I'm eating oatmeal and tadka dal, because of the what we call red chilies and other spices, they also have a little bit of sugar. They raise the triglycerides, and the tadka part of it was causing my cholesterol to go up. So my oatmeal and tadka dal was bad diet.
It doesn't taste nice. You have to add tadka. So going to the
Can you please share your diet though, if you don't mind?
I'll have to kill you if I tell you. I'm just kidding. I'll tell you. Yeah.
Regarding the markers.
Yes.
The cardiology side of things, the highly sensitive CRP.
Yes.
In the background for some time.
Right.
Can we use that? If all of us in this room wants to follow your advice and diet change, being not Indian. So which marker is the ideal marker with for monitoring?
Okay, so
Okay,
so I'll tell you another story. So I and my family and another friend who's another like guru who bagged 13 gold medals, who was my classmate. So he is a cardiologist in San Diego. So he and his family and my family, we went to Bora Bora on a vacation. So when we went there, I bought 2 Scotch bottles from duty-free store, and we went there. And before I left, I checked my liver, no fatty liver. I had my cholesterol checked. I checked my vitamin D level. I checked my markers for inflammation. So I was going to do an experiment for 10 days and come back and check. So I went there. We ate, we drank, we had a good time, finished the bottles, drank pina coladas, ate desserts and everything else. On December 27th, my family went to Northern California from Los Angeles, and I took the red-eye flight and came back. So that there in the airport, we had the last meal. I came back to Houston. 28th morning, I go in fasting. I check my liver, fatty liver, fibroscan, severe fatty liver. Okay, I do the blood work. My cholesterol was almost 400. My triglycerides were like 450. My liver enzymes had gone up to 300. AST and LTs were in 300s. My markers for inflammation, which ones are LPPLA2, L plaque. It's a sign that you have plaque that is getting ready to crack. That was through the roof. Oxidized LDL, that means LDL is normal. You have oxidized LDL. My oxidized LDL was very high. My CRP was very high. My myeloperoxidase, that's another one, MPO. These numbers were really high. Now I got really scared because here I am with these numbers. That means I have created plaques, and I don't know where the plaques are. If the plaques crack in the coronaries, I'm looking at a massive heart attack based on where it is. So what do? I basically shut down and start fasting for 72 hours. Now, every day I would go back and check my liver. And I saw that every day I fasted for more than 24 hours, it would drop by 20 points. By the time I didn't finish my 72-hour fast, my numbers dropped by 60 points on the fibroscan scale. That's point number one I learned. That means if I fast for 12 hours, it doesn't change. So I even did a study during Ramadan. When everybody would eat twice a day, I would for 1 month only eat once a day at 8:30 in the evening. I would break fast. And then after 1 month, I checked my liver. It did not change my fatty liver. 2, I even gained weight even though I was eating once a day because I was eating after 4 o'clock, 5 o'clock in the evening. You eat late at night, you become fat. So that's a second, that's a sumo wrestler type. Third, so when I checked these numbers, then I started checking them. After 7 to 8 days, actually 8 days, I checked my labs. All my markers, my liver enzymes, normal. My triglycerides, normal. My inflammatory markers had all dropped back to normal. Why? Because I changed my diet, I fasted for 72 hours, and I took Vasepa. And that changed in less than 10 days. The other thing I learned was my vitamin D level was 37. So I said, I'm going to go and just the shots and burn myself. So I burned my skin. After day 3, it was so painful for the next 7 days that I couldn't even touch the skin. So I thought my vitamin D level should be like 130, 140. I got back home and checked my vitamin D level. It was the same 37. And what I learned was if you expose the skin once or twice or 3 or 4 hours, you burn the skin, but you don't make vitamin D. You have to expose the skin every day. So I learned from these 2 patients, 2 Caucasian patients come at different times. One comes in with a vitamin D level of 130 and the Quest lab said 100 and over is high. This guy's 130. The other guy comes in with a vitamin level of 140. I look at them and said, look, dude, your vitamin levels are so high, it's dangerous. How much vitamin D are you taking? Both of them said, we don't take vitamin D. I said, wait a minute, you don't take vitamin D and your levels are this high? I've seen thousands of patients. Everybody's like 20, 25, 20, 25. And if you're taking 5,000, you're like 35. You rarely go beyond 40. How is it that you're 140 and 130? The first guy who is 140, Caucasian, he would swim every afternoon, 3 to 4. Guess what? He was exposing his trunk, making vitamin D. The other one, retired, put on his shorts, go and garden in the afternoon. Vitamin D. It's amazing. Daily exposing the skin. That means if you expose your legs, you don't make enough vitamin D. Expose your hands and face, golfers, gardeners, low vitamin D. Because everybody is all covered. Unless you expose the trunk for a long period of time every day, a short period of time every day, you don't make enough vitamin D. Yes, sure. Much melatonin. Yeah. Does that answer your question? Markers for inflammation?
Yeah. What you said was some genetic background, like you, maybe the same amount of food and alcohol, whatever your friends have taken, not have mounted similar response also that we notice it. But for a long term, that can precipitate acute plaque formation.
That's right.
Long term monitoring, let's say 6 months, 1 year at last.
It will
be these one
marker, myeloperoxidase, L plaque, and oxidized LDL. You know what? If you don't change your diet, it will never come down. Because I published a paper in American Heart Association where I was able to get it down by 36% by L plaque. But you know what happened? When the Vasepa came in less than 3 months, almost 80 to 90% dropped them to normal. So one, Vasepa drops markers of inflammation. That's point number 1. And that's probably why it helps in shrinking plaque and prevents heart attack. 2, fasting drops inflammation markers significantly lower very quickly. 3, changing diet drops in markers of inflammation. Because what did I tell you? If you give the body a chance to heal, it will heal, because we are all equipped with machines that are programmed and designed to heal themselves. All you have to do is get out of its way by eating the right food.
So if we are eating all raw food and.
No, I didn't say eat all raw food. I said you have only two options. If you want, like for example, nuts, eat them raw or eat them boiled. Don't eat them roasted, because roasted nuts will cause plaque formation.
We are following this lifestyle of boiled and raw and with whatever juices and thing in the whole day, with fasting every week, maybe for 48 hours or so.
Mhm.
Then 1 day of having a normal Indian diet.
Sure, that's what I do.
Are we at least able to compensate it?
That's what I do. I eat biryani, I eat halim, I eat nahari, you name it, I eat. But when I eat something like that, I fast for the next 36 hours. And I do take the Vasepa. And after that, I don't make the mistake again of eating it again very quickly. Because remember, in US, there's a 40% increase in heart attacks in the last 2 weeks of December and first 2 weeks of January every year. And the most number of heart attacks always happen on day of Christmas. Now throwing for Indians, they also have Diwali. They throw in more. So be careful of what you do. It is the successive eating of wrong food is what leads to plaque rupture. If you eat once, it's not going to kill you. If you eat twice, it's not going to kill you. But that's why people travel to India, eat a lot of food, then go back and I need to start exercising and jog, have plaque ruptures and heart attacks, or drop dead. And most plaque ruptures happen in January, because everybody has their New Year resolution and they start hitting the gym, and you have a soft plaque and you hit the gym, either you have a plaque rupture, heart attack, or it becomes the 90% you have angina.
The dairy and the dairy products. For the
Okay, so if you drink milk, it will not hurt you, except if you drink a lot of milk, it will cause obesity. That's one. Second, if you drink yogurt, yogurt is better because all the sugar is fermented. So yogurt is not going to hurt you, and it is not going to raise your blood sugar. But yogurt and milk will raise your cholesterol, but will not cause heart disease. I'm being very clear. Fat will raise cholesterol, but will not cause heart disease. Now, cheese will raise cholesterol, but will not cause heart disease. So when does it cause heart disease? When you eat cheese, it doesn't cause heart disease. When you eat cheese pizza, it's called heart disease. When you eat eggs boiled, no heart disease. Fried eggs, heart disease. Shrimp boiled, no heart disease. Fried shrimp, heart disease. Fish boiled or steamed, no heart disease. Fried fish, heart disease. Meats, steamed, boiled or raw, like steak tartare, no heart disease. You go to the other side, fried, grilled, anything, heart disease. Nuts, raw, no heart disease. Roasted, heart disease. Vegetables, raw, steamed, boiled, no heart disease. Grilled, fried, roasted, heart disease. It's the oxidative change that you cause. It has nothing to do with food. Food doesn't kill. What you do to the food and make it more tasty is what makes it toxic to kill you.
You were talking about the fermented fruit juices and separating the factors. So what if we over fermented, like wines, fruit wines, what we make in home, is that acceptable to?
Yeah. What do you mean by over fermentation? Explain to me.
We keep it for more days. Like,
so you know what I do? The leftover white rice, I put whole milk goat yogurt. I put some cream into it to make it tasty. Put a little bit of salt. In US we get this koji rice. It's like a fermented spores. I added to that. I add some miso paste into it, and then mix it up and put it outside and leave it there for 2 days. What do you think is happening to the rice? It's fermentation, and then I eat that. That is live food, because you're eating food that is teeming with different bacteria and fungi. Now, is that going to hurt you? No. And what did I say? Rice is not going to kill you. Yogurt is not going to kill you. Yes, yogurt may raise your cholesterol, but so what? It is not going to kill you unless you eat something that is oxidized. And if you're eating it with bacteria, how is that going to kill you? Sadhyanam. Eat it. That's a good breakfast. Or it could also be your dinner.
Learn how to make it tasty then.
Add a little bit of salt.
In the olden days, they used to add even onion.
Sure, raw onion is not a problem. Fried onion is a problem.
The regular dairy with the peanut milk and the almond milk.
Oh, that's a good question. Peanut, okay, peanut milk and almond milk. I don't know how they're making it in here, but in US, they actually sued the company because only 2% of the almond milk was almond. Rest of it was fillers.
Here, maybe there was 2%, here it will be 0.
No, you're right. You can make your own milk. Yes, like almond, so you know what I did? One day I soaked almonds, organic almonds, and I blended them, I strained them and made the milk. I put it in my mouth and almost threw up because it was so bad tasting. I asked the question, if I made this organic milk and it doesn't taste so good, how is the company making such tasty organic almond milk? What sort of fillers are they adding? What are the things they are changing that making it so tasty? So yes, I agree with you. Yes, you can make your own milk and drink it. It's not going to hurt you. Even you can make your own coconut milk and drink it. You can eat raw coconut. It's not going to kill you.
Yogurt with that.
Yes, you can. Yes, you can.
More bacteria than-
Absolutely.
A lot of Somalians here, they claim that the camel milk has a lot of health benefits. They don't put on weight. They drink up to 2 liters per day sometimes. And it does not cause constipation, no bloating, no gastric ulcers.
Again, same thing. I mean, there's a difference between how you respond to cow's milk and yogurt versus goat milk and cow. So it could be a little different in the absence of casein from what you get from the cow's milk. But I don't know about how the camel milk is superior to other milks. And Somalia, they don't get any other food to eat, so they can't be fat. Yes, yeah.
Oil is one of the important ingredients in our cooking.
So what did it teach?
Eating it less.
No. What is the message? I said, I eat a lot of oil. I actually drink olive oil, but I never heat the oil. There's eat the oil, but don't heat the oil to high temperatures. That means I put a lot of oil in the last final stages of my cooking and I simmer it. So do I eat oil? Yes. Do I heat it to high temperatures? No. Am I scared of oil? Absolutely not. Do I know that if I eat a lot of oil, will it raise my cholesterol? Yes. Does it cause inflammation? No. I'm being very precise. But how do I cook? Put water, put everything in, put your salt, black pepper, turmeric, if you want, put some red chili pepper, and let it cook slowly. Now, why did Columbus come to India? And then which spice? Black pepper. Vasco da Gama came to India, black pepper. Now, how many Indians cook with black pepper? Where did the red chili pepper come from? No, it was not native to India. Portuguese in 1640 or 1620 brought it from South America, and within 100 years, it spread like wildfire all over India, and slowly it replaced black pepper with red chili pepper. And now, if you look at Indian cuisine, everything is red chili pepper. But if you go back, everything ate was black pepper. Europeans wanted black pepper.
Regards to red chili pepper.
Mm-hmm.
And eat 3 or 4 red chilies, and it protects against all the 4 diseases: the cancer, Alzheimer's, heart disease, and including diabetes. So the Chinese eat a lot of red chilies. The entire Szechuan cuisine is nothing but filled with Chinese.
You're right.
Red chilies.
Right. So, but I agree with you. But my approach was, again, if you look at the Chinese, how is their approach? There are only 2 simple things. They rarely eat anything sweet. Chinese don't eat a lot of sweet. 2, they eat everything boiled right. So it doesn't hurt. So you can eat all those things. But I'm going back to the traditional way of cooking. If you really want the health benefits, it's the black pepper. We always evolve on black pepper.
It's good for us, a lot of weight loss. Best pepper that causes weight loss is black pepper.
Black pepper.
Not the red chili pepper.
Thank you very much. I hope you enjoyed the talk.
Yes.
Amazing. Amazing. I didn't expect this one. Amazing. You're like a preacher. Amazing.
You're my guru. In case
It
of
was excellent, but you made me feel scary. I told so that
No.
you can't eat food, you can't.
No, I made it very simple. You can eat everything. I just said raw and but
It's my sister. Yeah.
oh, there
It was excellent out of this one.
Hey, no,
It brought so much-
ఎక్కువ
Can I expect 10 minutes?
Huh?
Expect 10 minutes.
anything. I can